All right, good evening, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. And tonight we are talking about POTS, postural orthostatic tachycardia syndrome, and irritable bowel syndrome or digestive symptoms. So send us any comments or feedback you have on this, and I look forward to getting into the nitty-gritty of this, and we'll go from there. Okay, so I'm going to minimize Facebook. We're going to present from the beginning. Cool. All right, so POTS and IBS. So as I talked about last week in the broadcast regarding Ehlers-Danlos syndrome and POTS, again, for those of you who didn't watch, Ehlers-Danlos syndrome is seen in a significant percentage of POTS patients, or POTS is seen in a significant percentage of EDS patients, as it's referred to. EDS is a condition of collagen. It's a genetic condition, largely considered to be genetic. There seems to be some response to immunotherapies, and it's characterized in its hypermobility form as being the most common, but you can go back and watch that whole broadcast on EDS and POTS. Nonetheless, I attached this article because this was from the Cleveland Clinic, where they looked at a fair number of EDS patients, and they saw that they had a lot of digestive symptoms, basically. Most of them had motility issues, whether it be involving gastric motility or intestinal motility, small intestinal bacterial overgrowth. So that was observed. This is an article from the American Journal of Gastroenterology, where they're talking about how POTS is a thing now, and GI specialists need to be aware of POTS. And they go through a number of symptoms and how POTS patients can present with nausea and IBS-like symptoms and gastritis-like symptoms. And so that needs to be out there as well. And this was kind of more of a seminal article. This came out of the Journal of Neurological Sciences in 2015, where they basically said that like 86% of POTS patients reported nausea, IBS like 71%, abdominal pain like 70%, constipation 70%. So basically, digestive symptoms are super common in POTS. One of my takeaways from this is that there still is not a lot of research on this. And so, just like when I did the neuropathy broadcast, there's not a ton of literature on the association between POTS and irritable bowel syndrome, or POTS and digestive symptoms. There is some out there, but not as nearly as much as we need there to be. But again, keep in mind that POTS is a relatively new diagnostic entity, really coined in the 1990s. It's gained a lot of notoriety. Really in the last 5 years, you could say the last 10 years, but really the last 5 years, we're seeing kind of an explosion of the awareness of POTS. But still, so many of you, as I mentioned, the anxiety broadcasts are labeled as being histrionic or having anxiety disorders because you're young, healthy appearing people, most typically females. And so frequently there is this label of, oh, well, you just have anxiety. Well, you don't just have anxiety. One of my questions is, why do we see so much IBS in POTS patients? I think it's due to the hyperadrenergic state associated with this condition. There are still people talking about a hyperadrenergic state versus a neuropathic form of POTS. I think based on the newest research, what we're really finding is that the majority of POTS patients are autoimmune, and the signs of neuropathy, or small fiber neuropathy, which are the nerves that get blood, they go down into your legs, for example, and help to coordinate getting blood back up to your heart and your brain. It's really a question that if those neuropathy signs that were being picked up were really due to this autoimmune component to adrenaline and acetylcholine receptors. That's my stance at this point, but I could be wrong. So nonetheless, when someone has a hyperadrenergic state, you have tons of adrenaline, your digestion is not going to function as normally as it should. And so we should be in a rest and digest state to digest our food. Go back and look at any chart of the autonomic nervous system. When we are in a rest and digest state, we make saliva. We make hydrochloric acid in our stomach. we are going to produce other digestive enzymes out of our pancreas. We're going to have other mucosal secretions throughout the GI tract. We're going to have good motility through the peristaltic mechanisms. However, if you came down with a viral infection and then all of a sudden you develop POTS, for example, and now your immune system is attacking adrenaline receptors, 89% probability basically on the newest studies, or acetylcholine receptors, 53% probability, and now you're not coordinating blood pressure correctly and your heart rate is going super high because your adrenaline is super high, well, that high adrenaline is going to affect your GI tract. I mean, how many of you have been through a really stressful circumstance, studying for finals or loss of a loved one, and all of a sudden you're constipated for 5 days? That's pretty common, or maybe not 5 days, maybe 2 days, but you feel more constipated. Well, it's because the adrenaline is affecting your GI tract in a way, and also your brain is affecting it. But the adrenaline is affecting your GI tract, so your motility is off and not working normally. So that's a big deal. So I want you all to think of that, all of you who have POTS, think of that in the context of why you have digestive symptoms. And then once there is, what does it say, 70% of POTS patients have constipation in this study. I think they looked at 28 patients, not a huge sample size. But if 70% have constipation, well, once you have constipation, there's going to be a tendency for overgrowth of bacteria because things are not moving through. Your food is not moving through your digestive tract. When that happens, that fosters more bacterial overgrowth. And so then this whole cycle just keeps going. As you get into autoimmune research, you get into leaky gut, which is a horrible term, but basically refers to the intestinal lining breaking down. And when that breaks down, macromolecules like gluten or dairy peptides can start poking their head through. Your immune system freaks out, maybe starts creating more acetylcholine receptor antibodies or adrenaline antibodies. That is a hypothesis, but that is what we've seen in other autoimmune diseases. Or maybe the leaky gut from this bacterial dysbiosis is then facilitating other bacteria poking their head through and irritating the immune system. Because we now know, like with rheumatoid arthritis, that bacterial DNA are found in the joints of RA patients, and that those bacterial DNA molecules cause this specific reaction of rheumatoid arthritis. We now know lupus is due to a bacteria from the intestines translocating to the liver, to a place where it shouldn't be. And that evokes this specific disease process of lupus that came out in the world's second most foremost, or well, some say it's the top foremost journal in the world in 2018. So that's what I think about when I'm thinking about IBS and POTS patients. So let me see here. I'm just going to go to Facebook. And good evening to all of you who have joined. And let me know what you think. I hope this was helpful. And I'll put it on YouTube and we'll go from there. So have a really lovely evening, everyone. Stay safe, stay well, and I will talk to you later.